Just an itch, right? You feel a little itch down there. Maybe it's the new soap, tight jeans, the weather. No big deal, right? They open Google, type itchy groin, no rash, herpes simplex virus. Oh, okay. So now you're convinced it's the end of the world. You've got herpes, your life is over, and you're texting your best friend like it's your will. Relax. Let's break it down together. Because sometimes, an itch is just an itch. But sometimes, it's your body raising a red flag with no filter. This episode, Real Talk, Real Symptoms, Real Relief, will help you tell the difference, without the drama. Most people ignore the first signs. Why? Because who wants to think their genitals have a problem? Denial is the first defense, but sometimes ignoring that itch is like ignoring smoke and hoping there's no fire. Let's be honest, nobody wakes up and thinks, "Oh, that itchy sensation in my groin? Must be a sexually transmitted infection." We rationalize, we minimize, and in places where silence and shame dominate sexual health conversations, like high school, strict households, or even churches, we're more likely to not speak up. Meet Ella, 21, the "it's just razor burn" story. "I had just started dating again after a rough breakup," Ella begins. "It was summer. I shaved. I wore tight jeans. I was sweating. I thought the itching was because of that. I even laughed about it with my roommate." A week later, Ella had small red bumps around her vulva. She panicked, Googled, then panicked harder. It felt like I was being punished for moving on. Diagnosis: herpes simplex virus type 2, HSV2. Key point: the first outbreak hit her weeks after sexual contact, which is exactly how herpes works. Herpes doesn't knock. It slips in like a con artist. You might not feel anything at first, that's the trap. Dr. Andrew Collins, virologist at Mayo Clinic, explains, herpes simplex virus can lie dormant in the nervous system. Even after initial infection, it may take a week or more before you see the first outbreak, and sometimes the first signs are subtle, tingling or burning. Most STIs, especially herpes, don't show up right away. This is where things get dangerous. Let's break it down. Key insight: herpes is not rare. Nearly 1 in 6 people aged 14-49 in the U.S. have genital herpes. Most don't even know they have it. Dr. Lisa Cheng, OB/GYN and professor at Johns Hopkins University, explains, for herpes, the incubation period, the time from exposure to symptoms, ranges from 2 to 12 days. But in some cases, people can carry the virus for weeks before seeing the first outbreak. That delay is what fools most people. The body is silently fighting. You've been infected. You just don't feel it yet. This is why it's easy to mistake the eventual symptoms for something mild. After initial infection, HSV travels to the nerve ganglia, where it hides. That's why outbreaks return. Stress, illness, or hormonal changes can trigger them. The virus is like a sleeper agent, says Dr. Selena James, infectious disease specialist. It waits until your defenses are down, then it flares. Common misunderstandings at this stage. I feel fine, so I'm probably fine. It's been a week and nothing showed up. I'm in the clear. There's no smell or discharge, so it's not serious. Wrong. Your immune system is warming up for battle. And the virus, it's finding a cozy spot in your nerve endings. Before any bumps, blisters, or rashes appear, many STIs, especially herpes and pubic lice, send subtle signals. Symptoms during the prodromal phase: tingling or burning near the genital area, general fatigue or flu-like symptoms, itchiness that feels deeper than skin deep, crawling sensation at night with lice. Dr. Michael Rayburn, a sexual health expert from UCLA, puts it this way: it's like your body whispering, "Hey, something's off." But because it's not yelling, people ignore it. Treatment and management. No cure yet, but it's not a death sentence. Antivirals, acyclovir, valacyclovir. Suppressive therapy. For those with frequent outbreaks, barrier protection. Condoms reduce transmission but not 100%. Herpes can shed from skin. Real-life wisdom from Alex, 27. I take meds daily and haven't had an outbreak in 8 months. I date, I disclose. Life goes on. Prevention. Always use condoms or dental dams. Get tested together with your partner. Avoid intimacy during an outbreak. Communicate. It's not shameful to protect each other. Yeast infections aren't technically sexually transmitted, but they can show up after sex, and they mimic STI symptoms so well, they're often mistaken. Common triggers. Antibiotics, they kill good bacteria. Tight, non-breathable clothes, scented soaps, bubble baths, hormonal changes, high sugar diets. Dr. Morgan Lynn, OB/GYN, says Candida, the yeast fungus, is part of our natural flora. But when the balance tips, boom, it overgrows. Symptoms at onset. Intense itchiness. Thick, white, cottage cheese-like discharge, redness, soreness, or swelling. Burning during urination or sex, dry vaginal tissue in women, in men. Itchy rash on the head of the penis. Discomfort, redness. Case story. Jamie, 20. Jamie had her first yeast infection after switching from cotton underwear to leggings and using a scented soap. I thought it was an STI. I cried in the shower for like 30 minutes, but my doc said it was just yeast. I felt silly, but also relieved. Key lesson. Yeast infections are common and not shameful, but they do require treatment. While not life-threatening, untreated yeast infections can become more painful, lead to fissures or cracks in the skin, create risk for secondary infections, disrupt sexual and emotional health treatment options. OTC creams, miconazole, monostat, clotrimazole, oral meds, fluconazole, diflucan. One pill, usually enough. Natural remedies, only under doctor's supervision. Some people try yogurt or garlic. Dr. Lynn warns, don't put salad ingredients in your vagina. Ask your provider first. Prevention tips. Avoid tight pants or wet swimsuits for long. Use unscented, pH-balanced hygiene products. After sex, pee and rinse gently. Balance sugar and probiotics in diet. Real talk from Sophia, 19. I used to get 3 infections a year. Once I switched to cotton underwear and cut sugary drinks, I barely have any now. Sam, an athletic 25-year-old who loved leg day and protein shakes, started feeling itchy. He chalked it up to friction from cycling and synthetic underwear. A week passed. He still scratched. Then he noticed tiny specks, like sesame seeds, stuck to his pubic hair. I thought it was lint, like dryer sheet lint. That's how delusional I was. Turned out Sam had pubic lice. Sam's biggest regret? He had shared a towel with a friend at a party. He wasn't even sexually active at the time. Moral of the story: STIs and STI-like infections aren't always about sex. They're about exposure, and exposure can happen anywhere: dorm rooms, locker rooms, even sleepovers. What are pubic lice? Really, also called crabs, these tiny parasites live in coarse hair. Pubic, chest, armpit, even beards. Not the same as head lice, but just as gross. Transmission. Sexual contact. Sharing towels, bedding, or clothes. Aaron Blake, dermatologist and parasitologist, breaks it down. They feed on blood, and they cause relentless itching, especially at night. That's when they feed. 5 out of 10 days after exposure before you start noticing symptoms. During that time, lice lay eggs, nits, which hatch and multiply. Symptoms and clues. Itching that gets worse at night. Visible tiny bugs or nits on hair shafts. Bluish spots from bites. irritability, sleep issues, small red bumps. His story. Chris, 18. Chris noticed intense itching and thought it was jock itch. Then I saw a crab, like a real crab, on my junk. I almost passed out. He was sleeping on a friend's futon during a band tour. Turns out lice don't ask permission. Disease development. If untreated, lice multiply fast. They can spread to other hair-bearing areas, lead to skin infections from scratching, be transmitted to partners. Treatment and cleanup. Permethrin cream, 1%. Leave on for 10 mins. Rinse, wash everything in hot water, sheets, clothes, towels, shave, not required. Treatment kills both lice and eggs. Retreat in 7 days to catch hatchlings. It's not glamorous, Chris says, but it made me a hygiene freak. Now I carry my own towel everywhere. Don't share bedding or towels, especially in dorms or hostels. Do regular checks if sexually active. Open conversations with partners. Professor Renee Jordan, health education expert, emphasizes, pubic lice don't care about your hygiene or your popularity. They care about skin contact. Period. Not every itch is an STI, but every persistent itch deserves attention. These imposters might be hiding behind embarrassment, lack of info, or false confidence. Knowledge isn't scary. It's freedom. Life lesson. Quote from Ravi, 24. I thought it was just a joke, a stupid itch, but it taught me how to speak up, take care of myself, and not judge others for what they're going through. The body talks. You better listen. Okay, so not every itch is a red alert. Let's be real. Sometimes it's just your skin being dramatic, when it probably isn't an STI. Here's your personal itch check cheat sheet. If your situation checks most of these boxes, chances are you're not dealing with something scary. Harmless itch clues. You just switch to a new soap detergent or body lotion. If irritation started right after a new product, it's probably contact dermatitis, a skin reaction, not an infection. You shaved or waxed recently. Razor burn or ingrown hairs often feel itchy and can cause red bumps, but they're not contagious and usually resolve on their own. There are no blisters, sores, discharge, or pain. Most STIs come with more than just itch. If your skin looks normal and feels fine in a couple of days, you're likely good. The itching goes away within 24 to 48 hours. Fast resolution, true, low concern. It doesn't spread to other areas. STIs often start small and expand. If it stays put and gets better, that's a good sign. Expert take. Dr. Renee Matthews, dermatologist at NYU Medical Center, the skin in the groin area is super sensitive. It reacts to heat, sweat, friction, and hygiene products. A temporary itch doesn't always mean infection. The rule of thumb is if it improves fast and there are no other symptoms, don't panic. Dr. Isaac Romero, primary care physician, shared. Many young adults come in terrified. Once we take a quick history, no new partners, no sores, no discharge, and a new soap or laundry product, we reassure them. We want people to be aware, but not anxious. When it might be more than just an itch. Now let's flip the script. You've done the basic checks. It's not improving. You feel off. Here's when to pause and pay attention. Red flag itch clues. The itching keeps getting worse after 2 to 3 days. You notice sores, blisters, or ulcers developing. There's unusual discharge or a strong odor. You experience burning when peeing or during sex. It spreads to thighs, buttocks, or inner cheeks. You feel fatigue or flu-like symptoms. If you're ticking off more than one of these, it's time to get checked. How to think about itches. The 48-hour rule. Dr. Crystal Nguyen, Public Health Advisor. If an itch appears, take note of the time. Change up soaps or clothes. If it gets better within 48 hours, probably fine. If it worsens, spreads, or comes with anything weird, time to see a provider. It's worth mentioning stress can also cause itching, especially in intimate areas. Anxiety-induced itching is real. When we're hyper-aware of our bodies, even the smallest sensation feels magnified. Natural, soothers for non-STI itches only. Cool compresses, never ice directly. Unscented aloe vera gel. Oatmeal baths, colloidal oats only. Coconut oil, small amounts test first. Hydration plus probiotics for skin balance. Caution. If symptoms persist beyond 48 hours, even with these remedies, see a doctor expert insight. Dr. Kamani Foster, adolescent health specialist. The best thing teens and young adults can do is create a baseline of what normal feels like for their body. That way, when something changes, itch, color, smell, you'll catch it early. Getting checked without freaking out. Hi there, you're in the right place. Come on in. Getting checked isn't shameful. It's smart. Clinics are quick, private, and usually affordable or free. Why you shouldn't panic. Let's clear something up. Getting tested for STIs isn't admitting guilt. It's claiming ownership of your health. Daniel Wright, Director of Adolescent Health Services at Kaiser Permanente, puts it this way: if you care enough to get tested, you're already ahead of most people. Testing isn't about being dirty, it's about being responsible. There's no dark, creepy room, no judgmental nurse with a clipboard giving side-eye. It's just healthcare, step-by-step breakdown. Sign in. No need to say what you're there for, just check in, too. Intake questions. They'll ask about symptoms, partners, and history. Be honest, they've heard it all. 3-sample collection. This could be a urine test, a swab, or blood draw. Simple, fast 4 results. May take a few days. Some rapid HIV tests give results in 20 minutes, 5 follow-up. If anything's positive, treatment begins immediately. Dr. Kelsey Bernard, clinical psychologist, explains people fear being judged by themselves or by others. But that shame keeps infections alive and conversations dead. We need to normalize this. Get tested regularly, yes. Even if you feel fine. You don't wait until your car breaks down to change the oil. Same goes for your health. When to get tested? After every new partner. Every 6 months if you're sexually active. Immediately if you have symptoms. Once a year, even if you're in a long-term monogamous relationship. Dr. Simone Bailey, public health educator. Many STIs don't cause symptoms at first. You could have something and not know it and pass it to someone else. Testing is about responsibility, not panic. Quick stats. 80% of people with chlamydia show no symptoms. Genital herpes can lie dormant for months. HPV is often asymptomatic but can cause cancer if unchecked. Testing doesn't mean something's wrong. It means you care. Negative results bring peace of mind. Positive results bring answers and solutions. Silence never cured anyone. But testing, that's how healing starts. Don't self-diagnose or self-medicate. Googling your symptoms might be the worst first move, and buying random creams or pills online. Risky. Dr. Priya Kothari, pharmacology professor. Self-treatment can mask symptoms without treating the root issue. You might feel better short-term, but the infection keeps spreading. Also risky. Sharing antibiotics, using leftover meds, doubling OTC yeast treatments, assuming it's just a UTI without confirmation. What to do before you go write down your symptoms. Note when they started, what they feel like, and if they've changed. Be honest about partners. Even if it's awkward, your provider needs the full picture to help you. Don't feel pressured to get everything done in one visit. You can ask questions, take pamphlets home, or schedule tests for another day. Bring a support person. A friend can wait in the lobby or even sit in if you're nervous. Where to get tested. You don't need a fancy doctor or insurance to get checked. Where to go? Planned Parenthood offers low-cost or free STI testing. Local health departments, county or city-based clinics, university clinics, free for enrolled students. Community health centers, federally funded sliding scale, at-home testing kits, discreet, accurate shipped to you. Search tip Google free STI testing near me. Plus, your zip code. If you test positive, what happens? First, you won't be judged, you'll be treated. Here's the likely timeline. 1. You're informed confidentially. 2. Treatment is offered immediately. 3. You'll be advised to inform partners. 4. Clinics may help you notify them anonymously. 5. You'll be scheduled for a follow-up, important. Most STIs are curable, the rest are manageable. Getting tested isn't just about disease, it's about integrity. It's about love for yourself and others. You open the door to better communication, safer relationships, more confidence, less anxiety, mature adulthood. Let's turn knowledge into action. Here's what to keep in your self-care toolbox. Your STI toolkit. A list of nearby free or low-cost testing clinics. Condoms or dental dams always have extras. A health journal tracks symptoms, cycles, discharge, etc. A go-to supportive friend. An understanding of your own normal. Dr. Lucas Varela, CDC Public Health Advisor, shared, "If we could eliminate stigma, we could eliminate 60% of STI spread. The fear of being seen keeps people from being helped. But once they step into that clinic, everything changes. We meet them with dignity, not judgment. Don't let silence be your doctor. Go ask. Go check. Go own your health. Your body deserves gentle care. Let's start with the basics. We're talking about daily habits that can make or break your intimate health. Use mild, fragrance-free soap. Harsh soaps or overly scented body washes mess with your skin's natural pH. Dr. Layla Henderson, dermatologist and women's health researcher. Your genitals clean themselves. You don't need to scrub. You don't need minty fresh foam. You need gentle pH-balanced products. Cotton underwear, synthetic leggings. Cotton breathes polyester and nylon trap heat moisture and bacteria. Quick fix. Wear cotton or bamboo undies. Change out of workout clothes immediately. Sleep without underwear at least 2 nights a week to let your skin breathe. Talk to your partners, we get it. Sex talks are awkward, but avoiding the conversation. That's worse than awkward, that's dangerous. Ezra Martin, psychologist and sexual health advocate. The most mature thing a person can do is ask their partner, "When was your last test?" That's not being paranoid, that's being respectful to your body and theirs. Here's how to say it. "I really like you, and I think we should talk about sexual health before we go further. I got tested last month. Want to go together next time. No judgment at all, just want to make sure we're both safe." Mental health is sexual health. Anxiety, depression, trauma, all impact how we experience intimacy, sensation, and symptoms. Dr. Leo Strauss, therapist and trauma-informed health educator. Many people experience itching, dryness, or even pain during sex due to stress. The nervous system is directly connected to the pelvic region. If your mind is panicked, your body reflects that. What helps? Sleep, therapy, journaling, talking to trusted friends, mindfulness or body awareness exercises. Dr. Harlan Weiss, senior sexual health researcher at Johns Hopkins. If I could give teenagers one message, it would be this. STIs don't mean you're bad, dirty, or broken. They mean you're part of the human experience. Learn, treat, grow, repeat. That's the cycle. Professor Kia Daniels, youth health advocate. We don't shame people for breaking an ankle. Why shame them for getting HPV? The body is complex. So is life. Give yourself grace. That itch? Not so harmless after all, huh? Whether it was detergent or something deeper, you paid attention. You took control. You didn't panic. You didn't hide. You didn't Google yourself into oblivion. You showed up for your health, and that's the real win. Let's normalize taking care of our bodies. Let's stop treating down their problems like dirty secrets, because silence doesn't stop symptoms. But action? Action saves lives. Like, comment, share, subscribe. Someone out there needs this. Be the friend who sends the video.